ConsultingMD at the end of the day is really about expanding access to world-class care for patients, and at the same time, expanding the ability of world-class physicians to impact patient care. Today, if you think about how the system works for doctors and for patients, patients have a really hard time figuring out whether or not they're going to a real sort of top leading expert in their field, whether they're going to one of the best doctors that is available for them out there. And there's really no great way for them to understand sort of what the various quality measures are in their space and how to find a truly top specialist for their field. And when they get diagnosed with something serious, it's often very hard for them to go out and do what everybody says they should do, which is go and get an expert consultation or a second opinion. That is a tough place for the market to sit today, and it really does make it hard for patients to access world-class care. For those top physicians at the same time, it's incredibly hard to be as effective as possible. Physicians didn't go into medicine in order to tick boxes on an electronic medical record. They didn't go into medicine in order to make sure that all of the right billing fields were being selected as they addressed each patient care. They went in to help patients get healthy. And the existing system that's been built out simply doesn't allow for that. And so what we try to do for those physicians is deliver interesting cases that are really tailored to their specialty, and to deliver that in a way that is completely frictionless, so that they can get in, see the information they need to help diagnose that patient, help render up a expert second opinion for them, and then get that delivered back to the patient. And so we really are, at the end of the day, about easing the process for physicians, and at the same time making it so that patients can really access that top quality world-class care. We do that through two products today. The first is a quality referrals product. So we help patients to identify who the leading physician specialists are in their area on a comprehensive measure of quality. And then once we've helped to identify those physicians for the patient, and that really is tailored to that specific patient's needs. So not simply we'll send you to an oncologist, but we will send you to the best bile duct cancer doc in your local area. Once we've identified that doctor, we get the patient's sort of thumbs up that that's the doc they want to see, and then we go and we work to schedule in as expedited a manner as possible an inpatient, an in-office visit for that patient. That's the first product. So it really is helping to make sure that even from the very beginning of the medical interaction, patients see the top quality physicians in their area. The second piece is once those patients have been diagnosed with a serious disorder of one sort or another, and once they have that diagnosis in hand, we help them to make sure that their diagnosis and treatment plan is absolutely cutting edge and is sort of what they would receive at the top quality institutions in the world. So we help those patients to go out and see a leading physician, or really one of the top 2 or 3 physicians in their space. We package up all of their medical records. We package up all of their imaging. We put that in front of that leading physician, who then renders out a new diagnosis and a new treatment plan, and provides that back to the patient, really completely greasing the wheels in order to get a second opinion done. So there is no need for the patient to collect their own medical records. There's no need for them to travel across country to get in the office of one of these leading physicians. It all happens typically in the span of about 48 hours, which, if you think about it, and many of our doctors, if you wanted to see them in office, require about 6 to 8 weeks to book in an office appointment. They get opinions back to us in 2 days. So the speed, the ease for the doctors, the ease for the patients really is something that is unparalleled in the space.
Great, that's all great. I read that you're getting more requests from doctors to join the service, more than you can handle. How many doctors do you have now, and how many do you plan on sort of maxing out at?
Yeah, today we have hundreds of the leading physicians in each of their separate fields that are on our panel, and I think we have 2 different ways that we look at this. One is sort of our group of referral physicians, so those physicians who we think are tremendous physicians in each local area to whom we can send patients for in-office visits. And at the end of the day, we believe that we want to target about the top 5% of the specialists in the nation for that group, so that no matter where you are, you can have access to a tremendous physician in your area, and you can get in and see him quickly. For our expert consultation panel, for those folks who are helping with the second opinions, we think it's actually a really narrow group, right? Here we have worked to bring on the top 1, 2, 3 physicians in each of their fields. And when you look across the array of deep subspecialties, there are just not that many of them. So it's probably going to be fewer than 1,000 ultimately who we bring on within that capacity. So it really does depend on which of the two groups that you're talking about, whether it's in office or whether it really is focused on these electronic second opinions.
So what's your selection process like for the doctors you choose for the service?
Yeah, it's a pretty holistic process, right? Our belief is that that we absolutely have to have a through-going algorithmic way of looking at these physicians, and what we do today is look at a variety of different factors. Many physicians, I guess, if you look across the whole spectrum of physicians, for many of the factors that we look at, not every physician has a data point there. And so what we are able to do is really take a bunch of different data points, a bunch of different data sets, and merge those together to really understand from a holistic perspective for each of these subfields, sort of what it is or who it is that bubbles to the top. We think of that at a high level as falling out into several different buckets. A couple of the key ones are the physician's training. So where they did their fellowship, where they did their residency, where they did their med school, their institution with which they're currently affiliated, where they are today, where they're practicing, where they're teaching. Another big piece is their research, right? Our physicians that are on our second opinion panel are heavily published. They're the research leaders in their field who are also clinically active, right? This is and for us, the confluence of those two is really important. We need folks who are looking at these conditions on a daily basis and really looking at sort of what the cutting edge treatment is for each of these conditions. And that's why we look heavily to the research. But they also have to be folks who are very clinically active, who are seeing patients every day in the office, right? So this isn't somebody who's just doing bench research. This really is somebody who's seeing patients day to day. And the other piece here is their reputation. In many ways, there is nobody better to judge the quality of a physician than another physician, especially a physician who's worked with them, who's seen that physician operate, who's seen that physician help patients, who's seen how they work and how they interact with folks. And so we take those sorts of factors, really, all of those pieces, begin to bring those together and start to come out with a way that we can really say, you know what, these are the doctors who really distinguish themselves in that field. These are the folks who we want to make sure that we bring in and allow them to multiply their voice.
Great. Do you see any value in this service for doctors who aren't necessarily one of the specialists doing the consulting for the service?
Yeah, absolutely. I think again, we have two sets of doctors, right? So the folks that are doing that, the consulting piece of it, the folks that are helping with the expert opinion piece, are one smaller piece of that network. For a much broader array of folks, those folks who are part of our referral network, there's tremendous value. And that value is recognition that they are one of the top providers in their area, increased volume as we push patients to their practice because they are one of the top providers. So that's sort of very clear, very obvious benefit for those folks. But even folks who are not part of that network. So for example, our network focuses only on specialists, right? For general practitioners, you might sort of look at this and say, hey, you know what? At the end of the day, it doesn't really matter. We today already work with general practice physicians who are leveraging us as their referral network of choice. So what we enable them to do is to say, gosh, I'm going to give you a referral to this knee surgeon, and I'm not going to do it just because I know him and he's in town and I've played golf with him a couple of times, as cliched as that sounds, right? I'm going to do this because he is recognized broadly as one of the leaders in his field across a host of criteria, and we know that he does tremendous work, and I want to see you get the best care possible, right? So we work with physicians already today to start to enable that kind of interaction. And then I think the last piece is the doctors we work with are world recognized. Oftentimes when we deliver a second opinion to a patient, that patient will have a discussion. We encourage that patient to have a discussion with their existing treating physician and to talk about what it is that they're seeing. Not in anything like an adversarial manner, but simply say, look, here's what we've heard from this doctor. They seem to have a little bit of a different take on it than you do, or it's confirmatory, we should go ahead. And I think the ability I guess we've seen some surprise sometimes. Some of these physicians will say, holy cow, how did you manage to get in front of Dr. So-and-so? He's the guy who's always up on stage at conferences, but it's hard for patients to get in front of him. And I think that for many physicians, it is viewed by them as a great opportunity to get some of that sort of side-by-side experience with a true leader in the field that they would have a hard time getting otherwise, right? It is uncommon for many docs to be able to take a look at a patient, render up an opinion, say, this is what I think. Gosh, I wonder how Dr. So-and-so, who's the world-recognized leader in this field, would think about this too. And it's a tremendous opportunity for them to sort of compare notes. And generally, they being the existing treating physicians, really seem to enjoy that, really seem to like that.
What would you say is the most exciting new development or change coming up for ConsultingMD?
Gosh, I think for us, there's a bunch of stuff that's really exciting. We're working with some of our physicians in a research-focused capacity. So we are actually already enabling cutting-edge research in a couple of different fields where folks say, you know what, it is not always super easy for me to get access to some of these cases. Let me partner with ConsultingMD that sees a broad spectrum of cases, and let me work on those cases with them, and let me add that to my body of research. I think being able as a for-profit company in the medical space to be able to say, you know what, not only are we helping to take efficiencies out of the system, not only are we helping to improve the quality of care and reduce the net cost out of the system, being able to say that we're actively contributing and working with research physicians to build the broader base of knowledge in the space is incredibly exciting. I think also a lot of our partnerships with employers. So ConsultingMD sells direct to the consumer as one modality, but by far the more common or the larger part of our business is working with employers to cover their entire population of employees. I think our service is sometimes taken at first blush, and folks will say, "Gosh, this is a really expensive interaction for patients. Sometimes, it's high cost." But when we are working with employers, we're covering the entire employer population. We go out and we work with large employers that have hundreds of thousands, in some cases, of employees, and we help them to ensure that every employee at every level gets access to truly world-leading care. And what's exciting about that is we have found, as we partnered with them, that we don't only improve the quality of the care that their employees are seeing, we help them take cost out of the system, because better care is less expensive care, because people are diagnosed appropriately the first time, they are treated right the first time with treatment modalities that are appropriate and cutting edge for them, and as a result they get better faster. As a result, they don't have unnecessary surgeries or repeat surgeries. They're less likely to have negative outcomes. And what that means is that the episode cost, the total cost for the whole episode of the patient's care is actually lower. There's fewer hospital readmissions, all these sorts of great indicators that everybody's always talking about. And so what's been exciting to us is when we're working with these employers, not only do we broaden the spectrum of the folks who can get access to this world-leading care, we're also pulling cost out of the equation for the employers. And that kind of interaction is one where everybody sits there and says, gosh, if it weren't healthcare, this wouldn't be possible, right? There's not too many other industries where there's enough inefficiency in the system that you can really sort of just have better care or have higher quality product and at the same time have lower price. But healthcare is in an interesting space, right? It's got an interesting set of opportunities before it. And I think for us, the excitement of being able to interact at a research level, but also being able to deliver world-leading care to everybody within an employer population is tremendous. And that gets us out of bed every day and gets us excited.